Physicians have a really hard time accepting ambiguity. Similarly, our trainees through medical school have a really hard time not always having the right answer. In medicine, a lot of times we don't know what the answer is, and we need to be kind of comfortable with that and still kind of persist to find what's best for our patients. Our program, Vital, which is Visual Thinking and Art in Learning Medicine, it's a collaboration between the Department of Medicine and the BU Art Gallery to take trainees from the Department of Medicine, including residents and fellows, to the BU Art Galleries, using these techniques, both visual thinking strategies and other art-based pedagogical tools, to help us improve clinical reasoning, improve their teaching skills, comfort with ambiguous diagnoses, their comfort with empathizing with patients. That's how our program started. We have two activities, and I'm going to kind of start with the first activity, what we call back-to-back drawing. The role of the speaker is going to be to describe this beautiful sculpture in front of you, and the partner is going to sit with their back to you. Without peeking, draw what they're describing to you.
Yeah, so there's a smaller. It has kind of bars.
We got the hardest one
surrounding it. So imagine if it were.
The exercise is a good way to practice thinking deeply about how we communicate in teams, especially in healthcare teams where it's a very high stress environment and communication is key and we don't have the time to do it over again. The second activity we did was the visual thinking strategies. We have the whole group gather around a painting that we specifically choose for this activity.
We're going to discuss this piece. So what I'd like you to do is just spend some time looking at it, then we'll talk about it. What's going on here?
There's this group of figures that looks like they kind of left home pretty quickly.
It seems like a group is all moving from some place to another place.
What was your personal experience of going through the exercise?
I want to know what the right answer is, and that's not necessarily what art is about, it's what you see.
Right. You're absolutely right. There's no right or wrong here. But it is important to understand why we're thinking the way we're thinking. Physicians are notoriously bad at tolerating ambiguity.
Getting to appreciate ambiguity helps us appreciate these differences between ourselves as providers and also patients, meeting them where they are. Putting that into patient care, I think, is pretty special.
That's essentially the point of this activity, is there is no right answer, but just kind of being comfortable with that. And I think this activity has really helped a lot of our trainees be comfortable with the ambiguous.